Chronic metabolic diseases are nothing but commonly something which we all know as lifestyle diseases. I'll leave it to Dr. Rohit Warrior to delve deeper into that because he's really the expert by profession. I am, yes, into the corporate sector, but I have had a little bit of medical background as well, managing, a small hospital in Delhi. I'm a clinical nutritionist as well. And I'm largely my work ex is being that of a journalist, so I'm pretty new to the field as such, but as the situation of today demands that chronic metabolic diseases are emerging out to be as one of the biggest killers. They are the silent killers. We might think today everything is fine, but trust me, the lifestyle, the stress, and the diet that we all follow does not help at all. With so much junk food available at your fingertips these days, really, you have those food delivery apps, you have those Instamart apps where you can just order a pack of chips, a pizza, a burger within like 8 to 10 minutes. So things are really, really coming, to a head as far as our health is concerned. And the objective of this session is to basically not only tell you about chronic metabolic diseases, but also give you certain tips and educate you on how to handle delayed chronic metabolic diseases and why you should prepare yourself now at this stage, even if you're in your late 20s or early 30s. Now is the time really to start cracking the whip on maintaining a healthy lifestyle and basically start cracking a whip on all the bad habits that you guys have at the moment. So without further ado, over to you, Dr. Rohit Warrior, hoping it's going to be an interactive session. Please reserve your questions for till the end of the session. You can leave your questions in the chat box as well. We'll be very happy to answer. We'll keep the presentation short so as to make it more interactive. And Dr. Rohit, we have a couple of questions which are in the form of polls. Whenever you feel that we need to break the monotony, we'll toss over to those questions and people can answer and we can discuss that. Thank you. Over to you.
Thank you, Sana, for the good introduction. As Sana mentioned, we are actually facing an epidemic of chronic metabolic disorders, right? I just want to start with a simple, because I want to keep it interactive, I want all of you to participate. A simple question I would like to ask. How many of you know what is the average age at which we have the onset of type 2 diabetes in India? The average age, I'm talking about 2024 we are in. What is the average age that we see as per the statistics where there is diabetes being diagnosed? Anyone has an idea? You can chat or you can, just turn on your mic and speak, no problem. Anyone has a clue? So you'll be surprised to know, I'll do the breaking the ice in the cake right here. So you'll be surprised to know that currently the average age of onset of type 2 diabetes is in early to mid 30s, right? Now, if you look at it, probably 3 or 4 decades ago, the average onset of diabetes was post 50 years of age, right? What is it that has dramatically changed in this last 2 or 3 decades where the average onset of diabetes is happening in the early to mid 30s? We're talking about 20, 30 years earlier than what it was a few decades ago. So please understand the burden of the problem we are facing here. The reason why I want to, put out the statistics directly onto the faces, we need to understand it's a burning problem that we have right now, right? We may be fine right now. We may be sitting at the desk. We may be doing a routine job. We don't have any symptoms, right? Symptomatically are good. Yes. But please understand, symptoms don't tell your actual picture inside as far as your health is concerned. Do you know that diabetes or any of these metabolic conditions, especially diabetes, is called a silent killer, right? I'm not calling it even a silent disease. The nickname for diabetes is silent killer. Why? Because it's very silent in its presentation a lot of times. I may be sitting here, I may be talking to you. I don't know whether my blood sugar is in the abnormal range. I don't know whether my BP is going higher, right? And that worsens over a period of time. That's when a lot of patients actually start having symptoms. So it's a killer because every moment your blood sugar is high, it is causing disruption in your metabolism. It is leading you to more and more organ complications in the coming years. That's why people are ending up with kidney disease at a very young age, stroke at a very young age. So please understand, this is a huge burning problem that we are looking at. We need to do everything possible to ensure that we stay healthy. We do the regular checkups. right? We see if any parameters are going bad, what needs to be done early on to correct it. So with that introduction, I'll start my presentation. We'll keep it short. As Sana mentioned, I want it to be, a more interactive session. I'm not able to share my screen. Can you please
Yeah,
allow me to share?
done. Yeah.
Okay. So can you please let me know if you are able to see the screen? Is it visible?
Yes, it's visible.
Okay. So I'm Dr. Rohit here. I'm basically an American board-trained regenerative medicine specialist. So if you see here, the most important take-home point here is that early lifestyle interventions are very important to prevent or delay the onset of these conditions. Please understand, like I mentioned, 30s, you're seeing diabetes right now, early 30s. So that diabetes doesn't happen overnight. It happens many years before a person becomes diabetic. 10 years before that, the fatty liver starts. 10 years because before a person turns diabetic, you see that the insulin resistance is building up, the pancreatic function is declining. So there is a whole timeline of damage to a point where you actually end up with diabetes or high blood pressure or high cholesterol. So that timeline is so crucial. Those early years when there is damage happening inside you, where you're clinically not a diabetic yet, those early years, if you do the right things, right intervention, the exact precision diet, exercise, and sleep corrections, if you're going off track, you need to bring it back. If you do that early on, you can reset the path of your health. You can prevent the onset of these conditions, right? See, if a plane is going from Mumbai to New York, how does it know it's going in the right direction? You have a GPS. If the GPS fails, you have no clue where you'll end up in, right? And it's not that the plane suddenly goes off to a completely different direction. There is a slight offshoot in the direction, and that accumulates exponentially over a period of time, and then you land up in a completely different place. Similar to that, these metabolic disorders like diabetes, it's not that suddenly one day you end up with diabetes. The health is getting disrupted little by little, little by little, little by, and that's taking off in a tangential manner. And at one point, you end up in a state where you have high blood sugars, high cholesterol, high BP. So that's why early intervention is the key here. Once we start seeing the changes, you do the right things in terms of diet, activity, you can reset. It's like resetting your GPS so that you enter you reach the exact location, the destination you want. So you reset your biological clock, the metabolic clock, so that you continue to be in the state of right health. So that's why early lifestyle intervention is so important. Please don't think I'm okay now, I'm able to do my task, I'll take care of it 40 years. I mean, when I'm 40 or 50 years of age. No, the disruption might be happening right now. You have to look into it right now to see how you can correct it and so that you stay healthy for life, right? So fundamentally, any of these conditions you take, diabetes, blood pressure, cholesterol, these are all problems with the metabolism. That is, the metabolism is not functioning smoothly, the life processes. And the currency of the life process is something called ATP, right? Even you have a currency, when you have the Indian rupee, you can go anywhere, you can buy anything you want. Similarly, if you are having high ATP levels, you are able to do your regular activity, the body is able to maintain your sugar, your BP, etc. When the ATP bank balance starts going down, it's getting depleted, then all these conditions set in. There's a lot of evidence which shows that. So basically, it's a problem with the root cellular function. The ATP is depleting. So that is why if you do the right corrections early on, you can ensure that your mitochondria functions well, the ATP production is good, and you stay healthy for life. That's where exercise, diet, sleep, etc. plays a very important role. See, have a look here. This is how our metabolism looks. Can you understand anything out of this? There are millions of reactions happening at every moment. I'm sitting right now. There are so many reactions happening inside me. So many hormones are interacting. I'm not aware about it. Fortunately, I'm not aware. Otherwise, a person will go crazy if you have to understand what is happening within each reaction. But these are the kind of activities which are going inside your cell, right? So unless we have sophisticated ways to understand what is going bad in a particular person, it's very difficult to give a precision treatment plan, right? That's why technologies like Twin Health, we are able to map the individual's metabolism and give an exact solution so that we are able to reset the damage in the body's metabolism. So this is the staggering statistics what you're looking at. The current recent study which happened showed that 81% of people in India are having high cholesterol, 40% is having weight problems, 36 with high BP. I'm talking about a great chunk of our population. And please understand, all cross-sectional studies are generally underreported, right? Because you're just looking at a fraction of the population. So the problem might be even more higher. So we are actually in a state of war where we are fighting this epidemic. right? And it's a silent epidemic. Unfortunately, it's a silent epidemic. If it is causing a lot of noise, like COVID, people are out behind it. They do a lot of things to see how we can aggressively control it. This is a silent epidemic. We reap the consequence of this after many years, where we end up as kidney failure, heart attack, stroke, where we are disabled for life and we can have a shorter lifespan. So this is the alarming news reports that you're looking at. In Indians have premature heart attack. The early onset of diabetes is what is happening right now. Even young teenagers die of heart attack. We don't know whether diabetes has played a role there. It may be undiagnosed or high blood pressure or high cholesterol. But when they do exercise out of the way, they collapse because these conditions might have worsened the heart health. So the root factors which is leading to these conditions is the typical corporate setup, that you're seeing here. Unfortunately, I mean, we are in a hustle culture where we are on targets. But as a byproduct of that hustle culture, this is what we see. Sedentary lifestyle, high stress levels, high strain effects, and all the risks, what I showed you. We need to break this cycle because imagine 1 year, 5 years, 10 years, 15 years, you're in this kind of a pattern. That's when you end up with terrible health disorders, right? So this is unfortunately what is happening currently, and we need to break this. And education and early intervention is the way to break this, right? Once you're in a culture like this, the hustle culture, you need to be aware. Yes, this is a risk. This is where I am right now. If I'm in a risk like this, what do I need to do right now to correct it? That awareness you bring in and you do the necessary steps. You can still continue to do great in your job, in the corporate setup. And at the same time, you can ensure that you can protect your health so that you don't end up with those problems over a period of time. And exercise is a wonderful way to basically improve your metabolism. Simple, concepts here. Exercise increases your energy expenditure, enhanced insulin sensitivity. The fat oxidation is better. The muscle building exercises improve your muscle mass, so the glucose uptake is better. It improves your metabolic picture. Simple effects of exercise is what I'm talking about, right? But again, the specifics of what exercises, how much is it good for me? We need to have a tool which will exactly analyze that for you. And that's where tools like AI come into the picture. So these are the key features of metabolic disorders, right? They happen due to a lot of these factors, what I described, and is basically also fueled by the genetic predisposition. If your parents have had it in the late 60s or 70s, the next generation is having 10 to 20% higher risk of developing those conditions. And now with the current lifestyle that we are in, we see that these problems, come up at a much earlier age. So much sugar we are talking about. Please understand, one topic I have to talk about is white sugar. White sugar has shown to cause all these problems. White sugar consumption is so high. Any food that you buy from outside, literally any food, any packaged food is loaded with high sugar. You take the ketchup bottle that you buy, you see the sugar percentage, it's high. Any food is loaded with sugar because ultimately they want to sell you on the sugar. The reason why you buy a product is it tastes good. The sugar tastes good. That's why it's loaded with high sugar. And this high sugar is responsible for all these conditions: endocrine metabolic disorders, cardiovascular deaths, cancer. Please understand, cancer, there's a theory called Warburg theory, where cancer cells thrive on the blood sugar. The more blood sugar you feed it, they are very happy because they have a high metabolic rate. They are crazy cells. They want to just grow in a mad fashion. So the more they get sugar, the more they are happy. So any cancer of the body you take, any organ or any tissue cancer, the more you take sugar, the more the cells are able to proliferate and go out of control. So white sugar has shown to be associated with cancer also. So any disease you take, white sugar plays a role. So one of the fundamental things, if you are to shift this burden of epidemic diseases you're seeing, is to restrict consumption of white sugars. Very important. If that is done, that itself causes a great shift in the health of people, right? And gut microbiota. Please understand, most of the modern diseases or disorders start in the gut, right? The moment your gut biota starts going off imbalance, see, our number of bacteria in our body or the microbes in our body are 2 or 3 times more than the actual cells that we have. We are flooded, or we are surrounded by a dense network of microbial cells, including healthy bacteria. So imagine if your body is having 2 or 3 times more number of microbes on you, isn't that which is going to decide your health rather than your own body cells, right? And most of those microbes are located in your gut, right? So studies have shown that is the one which is actually getting disrupted early on. So the good ones are our friends, the healthy ones which we are born with. But the moment the pathogenic bacteria starts thriving, the harmful ones. That can happen in metabolic disorders where the harmful bacteria starts increasing in number. The good ones start dropping in its count. That's when we know that's the starting point of all these conditions. So gut bacteria has a tremendous impact on the metabolism. So any form of stress, any form of medicines like antibiotics you take, anything can hamper your gut bacteria. Right? If you're stressful, if you take a sample of your gut bacteria, you'll see it has a different composition. The harmful bacteria is higher. You would have noticed it. If you're in a stressful state, you're more prone to having gut problems, like your digestion is poor, diarrhea, constipation, whatever. Why is it? It is because the gut microbiota is going bad. So that's what you need to keep in mind, right? So please understand that the earlier on you take care of it, you can ensure that you stay healthy for life. Otherwise, you might think that you're okay, no symptoms, but please understand it's like using a credit card. You're swiping it, swiping it, swiping it. You're not thinking about the amount which you have to pay. At the end of the month, you see a bill, you're falling back. You're seeing it's a huge amount. If you're conscious early on about how you're using a credit card, you don't need to be worried about the final bill. So if you're conscious about how you take care of your current lifestyle practices, you don't have to worry about these conditions coming in years down the lane. So sleep. Sleep is very vital. Please understand sleep is not just a bodily rest we are talking about. Sleep is the state where the body repairs itself, right? The brain rewires itself. During deep sleep, the whole system goes into a state of, deep metabolic rest. And that is how we are able to gear up for the next day. So with the current lifestyle that we follow, a lot of times the sleep is disrupted, right? Sleep disruption over a period of time definitely has shown to lead to these conditions. So all these components decide your health, not just your diet, your physical activity, sleep, etc. Right? So please understand these are very, very important. Sana, should we have a poll in between to make it more interactive?
Yeah, Jagan, if we can have question number 1 and 2 together, because the first question, I think we began the presentation with that. So, but
Yeah.
we'll still like to take inputs.
Yeah.
So yeah, that's the question. At what age do you think cholesterol or diabetes becomes a serious concern? Please choose one out of the 4 options. Is it 20 to 30 years of age, 40 to 50s, above 60, or you haven't really given it a thought?
Yeah. So I'm putting the question number 2.
Yeah, go ahead, Jagan.
Yeah, so I think the correct answer for this is 20 to 30s, right, Dr. Rohit?
Yes,
Yeah.
absolutely, absolutely.
So most
So
people actually didn't get that right.
yeah.
Some of you did.
Yeah.
Yeah.
Do you believe metabolic disorders can be reversed with lifestyle changes? So yes, completely, only to some extent, not at all. I'm not sure. But please understand lifestyle changes, what we're talking about is, of course, using precision tools also. We need to understand that there are a lot of modern precision tools like AI available, which can exactly say what's the problem in your metabolism. So we are also taking that into the picture here. Excellent. This is the answer I was looking for. So it's an age-old concept that type diabetes or high blood pressure, high cholesterol, it's a lifetime disorder. People are put on medicines and you just keep increasing your medicines for life. And you still end up being uncontrolled and you still end up having complications. That is what we are seeing right now. That's how medicine has been taught traditionally. But the evidence is changing. The prime example is the AI-based interventions like Twin Health, where we are exactly able to understand what is happening in every person's metabolism, give a precision plan to correct it. I'm talking about precision plan. I'm not talking about a general plan. I'm not saying everyone follow 40 grams of carbs every day only. What your body requires, we need to identify that. Right? Exactly. Is it for you? Is it 40 or for you? Is it 35? That is what I'm talking about, precision. And the precision can happen only with fantastic technologies like AI-based digital twin, which can actually give you that insight. Right? So it's very much possible. And the whole evidence is showing that in the coming 5-10 years, the whole medicine, the way it is being taught is going to change. Right? So that's good. So these are some of the common myths that we see. See, please understand, cholesterol is always bad. No, Cholesterol is one of the important components of your cellular structure. If you're deficient in cholesterol, the cells will not have its normal structure, right? The problem is when they go abnormal, high LDL and low HDL. That's when the problem is. Now, diabetes only affects the blood sugar, like I talked about. Diabetes is not a problem of sugar. Diabetes is a problem of your organs ending up with severe damage. And that's the concern we are having. And you can end up with end-stage kidney failure. You can end up with end-stage liver cirrhosis. You can have severe heart attacks. That's the problem we are talking about, not just your blood sugar. Only overweight people get diabetes. Diabetes can affect anyone regardless of weight. Please understand, we have a lot of patients who are underweight and still having diabetes. Do not think obesity, yes, is a driver, no doubt, but we also have conditions where people are underweight or normal weight and still they end up with diabetes. There, the pathophysiology is different. The reasons why a person has diabetes is different there, but still you can end up with type 2 diabetes. So, like I said, you can reverse or bring your conditions towards remission. It is not that this is a lifetime disorder like what you see here. That's a myth. So please understand, we have tools to actually help you with that, and that is what these programs like Twin Health will actually help you. So, what has to be broken before you can use it? So, it's just it's on a light note. We are discussing this, right? What is it that you can break before you can actually use it? And if I have, let's say I have a cell phone here, I break it. It falls on the ground. It completely, shatters. The whole screen is shattered. I'm not able to use it. But there's something you can break and you can still use it, or even you can make it better. Any idea? It's a habit. The best part is a bad habit can be broken and you can replace it with a good habit. Please understand, this is the crux of these lifestyle disorders. What you do on a daily basis decides how your health is going to be. Every single act that you do, every single piece of food that you put in your mouth that gets integrated into your system and becomes your body, right? That decides how your health is. Every few steps that you take decides how much fat burn is happening. A habit of what you're doing, the micro habits decides your health in a long term, right? Please don't undermine that importance. Every single thing, once you attain adulthood, what you do on a daily basis, even your thought processes, are you having a good, happy, mindset, or are you someone who's always anxiety prone? That decides your health, right? So every single thing that you do decides your health, and that's what we frame it as a habit. So now the question is, how do we change the habits for good? That is what all this is all about. What is exactly for your body we need to identify, and we have to implement it as a habit. If I see for my body I require 60 grams of protein, I have to make it a habit daily. Every day I have to ensure I take 60 grams of protein, no matter what. If that becomes a habit, you have achieved the goal with respect to protein. The same thing applies to other components of diet. Same thing applies to your exercise. Same thing applies to your mental health. Every single thing. So these are the fundamental pillars of your health: a healthy diet, regular exercise, weight management, stress management, and adequate sleep. So this literally decides how how your basic metabolic picture is, because these are the only things which decide your metabolic picture. Nothing else outside this. A person may be a doctor, a person may be a collector, a person may be a person, maybe a auto rickshaw driver. It doesn't matter. Ultimately, those are social factors. The physiological body is the same for everyone. It is exactly the same. We are born with the same physiological parameters, no matter what you do in the world. So what you do with respect to that physiology is what decides your health. What you eat, what is the physical activity you do, what is the stress management that you're into, right? Literally, if you ask any person on the street, they'll always say they are stressed, even if it is a simple person who's is doing the job of a security. It doesn't make a difference. All of us are actually built into a system where we are stress prone. So for the body, that's what matters, right? The stress management, adequate sleep, this is what ultimately decides your health. So if you're able to tweak it in the positive direction for your benefit to protect your health, you stay healthy for life. So like we said, so I just want to open this up to the audience. Any thoughts on what are the bad habits that you would like to replace with good habits? Any one of you? I want to make it interactive. Any bad habit, any one of you want to replace it with a good one? You must be aware of your bad habits, right? It's just that you're not able to change it. That's where the problem is. You're not able to implement it as a behavioral change, but you know this is not good for you. That's where the gap is. That's where the gap has to be closed. So any such bad habit any one of you would like to change, would like to replace it with a good one? If you can just unmute and just come up.
Use mobile at night.
Yes, it's a very common habit that we have. In fact, it's more of a compulsion rather than it's a need. Because you're using it during the daytime, your brain is so hardly wired to the using your mobile phones. So you're literally pushed in doing it. You have to wake up early. You have a commitment in the morning. You have to travel somewhere. It doesn't matter. Your brain compels you to do it. You're with the phone from morning till evening. Your brain tells you not to keep it away. You want to continue looking at your phone. Unfortunate scenario, right? So this is where the gap is. It is not good for you. It is going to disrupt your sleep. You're going to wake up late and all the problems will come with it, but you're compelled to do it because that's a habit. It's a
Okay, now
habit which
lots
is pushing you.
of people are responding on the chat. Subrajit says he wants to stop being lazy and start doing yoga. Then people are talking about screen time. One says laziness to regular walking, and he also wants to reduce mobile usage, reduce stress. Hari Prasad
Yes,
says he wants to reduce stress. Shubham says he wants to sleep early and wake up early. Yeah.
great. Most of you have the right insight in what you need to do, but unfortunately, most of us fall short in implementing it, right? That's the actual problem. You know what is good for you, what is not good for you. Screen time is bad for you at night, but we continue to. That's the problem. We are caught up in the wrong habits. So the question here is, how do we replace it or supersede it with the good habits? That takes effort, no doubt. But you have crossed the first step. Now, going ahead, what you need to do is you need to have that effort and the right support system, and you need to have a tool which exactly identifies what is precisely good for you and what is not good for you. That's why programs like this, what we're talking about today, the AI-based programs like Twin Health can be revolutionary in supporting you with that process and helping you to get back to those state where you're able to replace it with the good habits, right? So a little bit about the AI, how AI is revolutionizing the whole paradigm of healthcare. Right now, there's a concept called whole body digital twin. Right, it is used by NASA and other large scale projects where the whole idea is very simple. If a system can break, that's a fundamental understanding. A system can break, right? If that's going to break, what is the best way to prevent its breakage? You develop a digital twin. As simple as that. You're developing a twin of that in the virtual platform. Even if it breaks in the virtual platform, what's the problem? It is only breaking in the virtual platform. You can always find solutions to repair it in the virtual platform. And that you can translate it to the actual physical model. That's when you can actually prevent the breakage in the actual physical model. That's the beauty of a digital twin protocol. That's what NASA has been using. So imagine if you're having failure rates for launching rockets or space mission programs. Can you imagine the amount of dollar loss that you're having for any of those projects? It's unimaginable. So when you have a digital twin like this, which exactly tells us this is the probability of failure with this particular parameter going bad, you can fix it on the ground. You can change those parameters so that doesn't happen when the rocket is in motion. Exactly the same thing is happening in the healthcare. When the system can be broken, the metabolic system, that is what we're seeing right now with the burden of diseases. You have a model where you can work on the virtual platform called the whole body digital twin, and that will exactly tell you this is where you're going. This is why your blood sugars are going high. This is why your BP is going high. This is what you need to correct it. When you implement it on your daily life, you're repairing your system back to its state of best health. How do we develop a whole body digital twin of you? We use sensors from your body. We need data, that is all. That's the raw material for developing your replica. So we need the CGM, the smartwatch, BP monitor, body composition scale. These are the basic tools which analyze data from your body, and that data is used to build your digital twin, right? This is active data. Every moment my sugar is changing. Every moment my BP is changing, right? Every moment my heart rate is fluctuating up and down. That is the data which decides your metabolism, right? That is a sign of your life process inside you. So that data is collected by these sensors, and the technology builds a digital twin of you using that data as a raw material. Now, since this fellow is an exact replica of you, it knows exactly what you need to do in terms of nutrition, in terms of sleep, in terms of activity, in terms of breathing, right? It might identify, hey, your deep sleep is poor. You need to increase deep sleep by 5%. Your breathing is very erratic. The breathing has to become more gentler. So this is all about precision care, right? And nutrition is not just about protein, carb, and fat. Every single piece of item you eat has micronutrients. 87 nutrients are there in every food item that you eat. Everything has to be brought into precise balance for your optimal health, what your body requires. That is where technologies like this can be revolutionary and identify what you need, what not what your neighbor needs. Your neighbor might require, 2000 milligrams of potassium, but you might require 3000 milligrams. We need to identify what you need. That's why we need a digital twin of you. And the way we develop a digital twin of you is using the sensors like this to build your replica. That's what programs like this exactly does. So this is how it works on a real time. Data is taken from a patient or from any person who's wanting to, improve their health, and that is going into the technology to build your digital twin. The technology exactly tells you what you need to do on a daily basis, moment to moment, what you need to do. I didn't sleep yesterday night, so my BP is high today. The technology identifies that because it's a replica of you. It says the sleep is poor, the BP is high. You need to do this one particular thing. You need to have a power nap in between, right? Or you need to take a certain supplement which will improve the BP. So that's how it works. It's a real-time analysis and a real-time feedback, right? Not something which happens at long intervals. Every day, every moment, you need to get insight. That's what these technologies do, actually. So in summary, this is how it works. We need to understand a healthy metabolism is a must if you want to stay healthy for life. Any modern disease you take has its root in disrupted metabolism, whether it's cancer, diabetes, high blood pressure, high cholesterol, Alzheimer's, Parkinson's, any modern disease you take is happening due to disrupted metabolism. Because for the simple logic here is when you're born, do you have any of these conditions? I'm talking mostly. There are certain conditions of neonatal diabetes and all that. That's a different scenario. But when a child is born, does he come with Parkinson's? Does he come with Alzheimer's? Does he come with high cholesterol? Most scenarios, no. This is something we gain over a period of time due to disruption of the metabolism. Now, the technologies like this will identify what you need and get you back onto the track so that you're able to go back to a state of best health, which all of us are endowed with, when we are born. Yeah. I think we had one or two poll questions further, right? You can just highlight that also, Jagan.
I'm doing that.
Yeah.
We have 3 more questions. Yeah. What's your biggest barrier to maintaining a healthy lifestyle? Is it the lack of time, or you're not motivated, or you're confused about what's healthy for you? And the last one is cost of healthy options. I mean, sometimes it's all together, but which one do you resonate with the most?
Yeah.
I think
Yeah.
is the answer.
It's more of a personalized answer that we're looking for. I mean, it's different for all, but all of them play a role, right? For some, it's more of the cost. For some, it's more of motivation issue. Some is more of lack of time. And of course, there's a lot of confusion about what is exactly good for you. So yes, but most of you are saying it's lack of time. That's very true. All of us, that's exactly what I was talking about, the hustle culture. We are all caught up in day-to-day deadlines, right? We are driving the system to supraphysiological limits. We are driving it to work beyond a certain comfortable level. And that's what leads to these problems, health problems.
And very interesting, these answers. 0% think that about the
Oh,
cost, mostly because they are just figuring it out. So people don't have time, or they're not motivated enough, or they're confused. So once
right.
you start following a regimen, or once you start adopting a lifestyle, then you come and think about what is good for me to eat, whether rice flour is good or almond flour is good, or the regular atta that I'm having is good. So yeah, interesting. Okay, so
Yes.
the next question is about somebody in your family who has been previously diagnosed with a metabolic disorder. If we
Can
have,
you have the question up? Now, Jagan?
Yes, yes. Next.
guys, please be ready with your questions right after this one more question, and then we'll open it up for interactive session. So please let us know if you have any personal queries, queries related to your parents, your in-laws, your kids. We'll be happy to answer.
It's not visible yet, Jagan. Are you opening it?
There is some technical issue. I'm just taking. Yeah.
Okay.
Okay. Fine. Till then, we'll take up the
Yeah.
questions. Okay, the question is there. Has somebody in your family been diagnosed with a metabolic disorder? Metabolic disorder can be type 2 diabetes, PCOS, hypertension slash high blood pressure, or fatty liver, high cholesterol, also known as dyslipidemia. So any of these conditions in your family, or maybe you are battling one of these conditions. Hmm. 8% not sure, 33% nobody, 42%. So maximum people say yes, family member, and 17% of those who are with us, 2 people out of 12, are suffering from a metabolic disorder. Okay, last question. Do you believe metabolic disorders can stay hidden for years without any symptoms? Or do you think that from the initial 1 week, 1 month, 2 months, you start seeing symptoms? Or can the symptoms be hidden for a very, very long time? It's a slightly technical question. Unless you yourself have, seen somebody very close in your family or you yourself, maybe it will be slightly tricky.
Right. So I think that's a good answer because most of you are saying yes, but you're not sure how often. Some of you are saying, yes, I heard this happens. In fact, it's very, very true. I've seen a lot of younger individuals. They just come to me. They say that, 2 years ago when I did my blood test, I was okay. Or 3 years ago, I was okay. But now when they come with a blood sugar of 300. They come with a HbA1c of 12. That means very high sugars. And they're absolutely fine. They say that my routine is okay. I'm doing my routine. I'm able to work. I'm able to do what I want, what I need to do on a daily basis. That's the unfortunate scenario. Because symptoms don't correlate with your health, right? Symptoms is just the body's response to certain things going wrong. If your body's fundamental framework is healthier, you might not have much symptoms also. But when the sugars are high, that is causing disruption inside you. See, imagine you have a piece of white paper and you're putting white wet paper. You're putting 1 tablespoon of sugar onto it. It sticks onto it, right? Now I decide to put 3 tablespoons of it. The same 3 tablespoons will stick onto that same wet paper. Why? Because sugar is very hygroscopic. It sticks to the water in the paper. Similar to that, our body is 70% water. So if your sugar is 300 instead of 100, do you think the sugar will just float around without touching anywhere? It is going to stick literally to every cell in your body. That's where this problem starts. It starts forming chemical reactions and disruptions and poor health. So if your sugars are high, it's a red flag. You're heading towards danger. So it's very important that you do the necessary treatment for that.
Yeah. So questions, Shivani and Hari Prasad both have questions related to sleep. So we want to know, Dr. Warrior, how can one get sound sleep? And, with work, how does one manage? What can we take some supplements? Should we take some supplements? What about, other factors that affect the sound sleep?
Yeah. So that's a huge challenge that we are seeing nowadays. People are having chronic insomnia, and that's all related to the work that we do, to the kind of lifestyle that we follow. So a lot of times, what first and fundamental, foremost important thing is we need to analyze where the sleep is going poor for you, right? Is it the quality of sleep? Is it the duration of sleep? Is it the deep sleep? Is it the REM sleep? So only based on that we can intervene. There are people where, if you're on hooked onto your phone and because of that reason you don't go to sleep, you're continuously on the screen. The simple solution is keep away the phone and try to use support systems to achieve that. You'll fall asleep. But there are people who fall asleep, but the quality of sleep is poor because they're not having good percentage of deep sleep. There, certain supplements can be beneficial, like melatonin or chamomile tea, etc., which has shown some benefit. But I wouldn't recommend it to use it as a blanket solution. Someone says my sleep is not good. I wouldn't just go ahead and say, go ahead and take melatonin. No, we need to individualize the therapy, find out what is exactly the problem of sleep with you. That's where technologies like this can do the job for you. It can actually analyze where it's going bad. What is the component of sleep which is going bad? And we give an exact solution catered to that. Otherwise, blanket therapies where I say everyone takes melatonin, that's not advocated. We have to individualize the therapy, and that's very important.
Right. Like, for instance, personally speaking, Dr. Rohit, like for me, sometimes when I don't feel sleepy and I really have to push myself, either I'm stressed out about something and I'm not actively thinking about that stress point, but it's playing at the back of my mind. So then
Right.
in that case, I have to, work towards diverting my attention, figure it out. And point number two, maybe I did not do much enough, enough activity during the day. So physically, I'm not that tired that or
Yes.
as soon as I go to bed, I'll sleep. And the days that I'm like physically tired or I've worked out more actively or I've walked or I've, indulged in any activity, then
Yes.
tends to sleep early as well. So it really
Exactly.
varies person to person.
Exactly. So one thing is clear, everyday exercise is definitely beneficial. The physical activity, what Sana is mentioning, is very true. If you are very sedentary, people tend to have sleep issues because your brain is constantly working, but your physical self is not moving around. And that's a dyssynchrony. Your brain and mind and your body should work together. You're designed to move, right? So that's why physical exercise is very important. That's a fundamental thing. But how much of exercise, to what extent is good for you, what kind of exercise, that needs to be personalized based on your current clinical picture.
Ravi Teja asks, what are the lifestyle changes that we should make if we are diagnosed with pre-diabetes and we are borderline, moving towards high cholesterol, but it's not high, but it's not low as well.
Yeah. So prediabetes is a precursor for the full-blown diabetes. So that's generally a warning sign that something is going bad. See, please understand, like I said, it takes a decade of metabolic damage to actually end up even with prediabetes. So it is not that your sugars are slightly high, the problem is only starting now. Many years before that, the problem has started. The insulin resistance is building up. Simple lifestyle correction, you have to start with some degree of carbohydrate restriction and increase in the protein, avoid white sugar daily, exercise 150 minutes per week. Exercise is mandatory. That is brisk walking. But again, this is a general recommendation. General recommendations do help, but it is not an all-in-all solution. People still end up progressing towards type 2 diabetes, and that's why we need individualized plan, precision medicine, what your body requires. That's why AI tools can be very, very beneficial. But these are the general principles you need to work on. Avoid white sugar, keep the carbohydrates low, increase the protein, daily exercise, which is that these are the crucial things, and of course, a healthy sleep. So that can help you to a great extent, right? But that is not an end all solution. But I'm saying it's going to help you for sure. End all solution means we need to exactly analyze what your body needs.
Uh, so we have another question. I really want to clarify. Shubham asks what precautions to take for bettering slash maintaining metabolism and symptoms of embolic disorder. I am assuming that you are referring to embolic disorder and not metabolic disorder, which is connected to heart health. Please
Yeah.
correct me if I'm wrong. So yeah, doctor, please answer.
Yeah, so embolic disorders, it's not, I would say it's not a very common problem that we see. It's something called thromboembolism, where you find blood clots happening, suddenly out of the blue. And if it goes into the brain, it causes a stroke. If it is happening in the heart, it's a heart attack. So, but please understand, embolic disorders generally happens due to high inflammation in the body. And the body is constantly due to high diabetes, high cholesterol, high BP, etc. When there is inflammation happening, inflammation is the body is undergoing a lot of stress. See, when you look from a distance, when you see the smoke, you know that there is a fire beneath it, right? The smoke is like the inflammation. that it's a byproduct of the fire. So the inflammation in the body, there are certain markers we look into like CRP, ESR. If that is high, that means there is a lot of fire which is going on in the body. There's a lot of damage which is happening. So inflammation being high is the core reason why people even end up having thromboembolic episodes, sudden blood clots. So that is related to your diabetes. It is related to your high blood pressure, to your high cholesterol. So fundamentally, these metabolic disorders also play a role in these thromboembolic problems. And there's a lot of evidence to show that thromboembolism is a much more higher prevalence in patients with diabetes or any of these metabolic disorders. So what is the precaution? Look into these parameters, see how your blood sugars are, your BP is, your cholesterol, and try to maintain it on target and follow those basic principles, what I told you. But if you want a precise solution about how to ensure that these parameters are staying healthy, you need to use AI models like Digital Twin, which will give you a very detailed analysis.
Yeah. Another very, very interesting question, and something which we see now increasingly in our day-to-day lives, is the cholesterol deposits on the eyelids sometimes, or on the lower
Yeah.
part, under eye area. Poonam asks, every year she goes for the cholesterol test, but the range shows normal, but she still has those what are commonly known as cholesterol deposits. So she wants to know, is xanthelasma really caused by cholesterol or some other deficiency or excesses?
Yeah, so xanthelasma is in fact very closely related to poor cholesterol metabolism, but it's not that always you have xanthelasma, you should always have high cholesterol. It can happen in scenarios where the cholesterol is not a problem also. So xanthelasma is just an indicator that you might have a high cholesterol problem. So you don't need to, if your cholesterol numbers are coming good, again, coming good, we have to be very specific about the numbers. That is, the LDL should be at a particular target, the triglyceride should be at a particular target. I mean, if you're a non-diabetic, at least LDL should be below 100, the triglyceride should be below 150. If you're a diabetic, the target is even more stricter. It should be below 75 LDL. Triglycerides below 100. So if your cholesterol parameters are very good control, then xanthelasma is not an issue to be worried about. And also you need to look into certain other parameters like apolipoproteins. They can also decide your cardiac risk, right? So those also you can look into. So let's say if the cholesterol is good, the apolipoproteins are good, you don't need to be worried about. You don't have to think that the xanthelasma is still something that we need to dig in deeper. But like I said, if every person
One
who
more
has a
thing,
xanthelasma has to look into it.
let me interrupt, because this also becomes a, image issue also sometimes, because people want to go in for laser removal because it really,
Yeah,
people are not comfortable with, a deposit showing up near the eye area. So,
yeah.
what are the other markers that they can look at, and what is the solution?
Yeah. So for the cosmetic reasons, I don't, my understanding is I'm not very sure whether dermatologists actually do laser for or any of the therapies for xanthelasma because it's a localized fat accumulation. Laser treatment and all that is mainly for warts, viral warts, in those conditions. But xanthelasma, I'm not very sure how, whether such therapies are available for those patches per se. But you can always have a discussion with the dermatologist whether you, for cosmetic reasons, if you want to get, rid of these xanthelasmas. But otherwise, like I said, if your blood parameters are good, the apolipoprotein and lipid parameters are good, there's no concern for worry. But at the same time, also ensure that you have a regular cardiac checkup also. That includes an echo, a TMT, after consultation with the cardiologist. So then if all these are good, if all these are having a green signal, you don't need to be worried about. You're doing well. Xanthelasma is just it's a benign thing that you're looking at as far as you're concerned, right? So that's how you should look at it.
Thank you, doctor. Another member joining us asks that he is thinking of the next day sometimes, when he's going off to sleep. He's planning his next day at night, which is also very common. And because of this, he's not able to get a peaceful, full night of sleep, and he wakes up feeling dull in the morning.
Right. See, one simple way to do this is, see, when you're always thinking about what needs to be done the next day, the best thing is you let it down, in a particular way where you're taking the load off from your system. That is, if you have a notebook, you just write it down. What is it that you're planning for the next day? So when you translate those thoughts into an action, you write it down somewhere, or you jot it down in your electronic book in the laptop. You're actually translating it to action. So in that way, you're put to rest. So a lot of times I've seen people that works for people. They just jot it down an hour before bedtime, in their dairy or wherever. And that way you see that you're actually able to get some good sleep. Otherwise, if you don't translate it to an action, that continues to cause stress in your system, because it is continued to have, it is actually literally, it's taking up your energy inside your system. So you have to let that energy out by doing any of these actions. And that way, I'm sure that it will make a difference. And also added to that, do not take any stimulants late evening, caffeine, green tea, etc., post 6 p.m. Right, and then that also adds to this problem. So with that, I think you should be able to feel better.
I think we have time for just one more question, and it's a question that I can also chip in with. The question is about dark circles. So
Yeah,
I personally have battled dark circles, and I've come to realize that there are two reasons for dark circles. One of them is genetic. So really can't do anything except use a concealer and hide those dark circles, or slash learn to live with them, because it's really okay. If you have dark circles, they're part of your personality. Uh, the other thing is, Dr. Rohit, if you bail me out, the right nutrition, the right sleep, and the right activity, and taking care of your gut health. If you do all these things, then your gut health hopefully will be better, because if you're eating right, if you're sleeping right, if you're doing the correct amount of activity, then overall you'll be healthy, your skin will be healthy, and you will feel fresh. And also sleep is very important in this, because the moment your eyes are tired and you're not getting a good sleep, then that will show through the eyes and through the under eye bag slash dark circles, other problems. Dr. Rohit, because you know I have done my fair bit of research, because I
yeah,
had the same issue and I realized I can't do anything about my dark circles.
yeah. That's very true. So again, for cosmetic reasons, like Sana mentioned, it's more about accepting it and trying to conceal it, as she mentioned. But dark circles can also be a problem because of these factors, sleep issues or stress, right? And that can turn up as, this kind of a phenomena that you see. So you have to take care of the root factors there, not focus on the dark circles. If your sleep is good, if you have a good supply of antioxidants, you can take vitamin E. It's a very commonly written antioxidant. There's no harm in taking it, in the normal physiological dose. You can take it for a certain duration, 3 months or so. There's no harm. You can take that. That antioxidants also help, to recoup the body's health. That you can do. And most important, the healthy nutrition is, like Sana mentioned, is the balanced nutrition is very important. And if your metabolism starts getting healthier, you see that this problem of dark circles is also better. So there's a very common saying that your eyes is the window to your health, right? So whatever is on your eyes or around your eyes actually talks a lot about your health, right? That single thing, that's what even doctors look into. Whether it's jaundice or whether it's anemia, dark circles, xanthelasma, so many things we get clue. So if your metabolism is healthy, you'll see that you have bright eyes to a great extent. So take care of the metabolism. If that's good, you should see that the dark circle problem also comes down, right? So that's the point.
Right. And before we end the session, may I request my colleague Bhavishya, who's also joining us here in the window. We'd really like to thank you all for being with us, making this session interactive. Lovely questions, very diverse set of questions. If you have any more concerns, feel free to reach us out on this number or through the plan cover team. We'll be happy to give you, any one of you, a free consultation, from Twin Health. And Bhavisha, if you can share the brochure, because there is some, literature that you might be interested in. There's the Google Drive link. You can go through the brochure. We essentially at Twin Health, what we do is, Dr. Rohit would agree that, today, no matter how good the doctor is, the doctor cannot really focus on every patient and read thousands and thousands of data points and to be able to precisely tell you how many steps you need to walk in a day to day based on your current metabolism, how many hours of sleep you're getting, and how much of that sleep is good quality sleep. So I know you have activity trackers to track sleep, but then to get these data points and to make sense of it, this is possible through AI. And that's why we know that everybody's metabolism is very unique. It's very different. It changes from minute to minute. So we at Twin Health have figured out that once we try and figure out personalized care for every individual and a very, very precise treatment for every individual, because everyone is special and everyone has a unique metabolism. We are able to give them precision recommendations so that they can start following those AI recommendations and really reverse their chronic metabolic condition. So much so that if you're taking medication for, let's say, type 2 diabetes or fatty liver or hypertension for 10 years, 12 years, you're able to completely eliminate that medication, in some cases reduce that medication within a few weeks of joining the program. So the brochure is shared with you. Thank you so much, everybody. Thank you, Dr. Rohit. As always,
Thank
very
you.
insightful. Thank you, Jagan. And last but not the least, all the participants, we thank you so much for joining us. Thank you.
Thank you, ma'am. Yeah.
Thank you.
Thank
Thank
you,
you
Dr.
all.
Rohit.
Yeah, thank you. Thank you, Jagan. Thank you all taking time out. And great to have this session with you all. And just reach out for any questions you have.